simple as that. Thank you. You do not have to do what you're doing. So it means a great deal, not just to me personally as the First Lady, but to all those kids that are living in your communities who are counting on all of us to get this right. Thank you. Thank you for everything you're doing for our young people. Thank you for all the work that you do day in and day out to make your community stronger and healthier. And let me tell you, I know that it is not easy to be you, to do what you do. You all are pulled in so many different directions. You're dealing with tighter and tighter budgets. You're working to keep your local economies humming and your neighborhoods thriving. And of course, you're trying to keep everyone safe. Yet even with all that on your plate, you all have still made the health of our young people a priority. And you're doing it in new and innovative ways that touch so many parts of your communities. For instance, last year in Missoula, Montana, they created Let's Move Missoula, a coalition of city and county agencies, hospitals, and nonprofits, and the Chamber of Commerce. And so far, they've set healthier standards for all of the vending and concessions in public spaces throughout the community. They've given all their 4th and 5th graders access to free open gyms with programming from the Parks Department. 6th graders in that community get a free year-long membership to the YMCA. And this summer, they're promoting an Unplug and Play Outside campaign to do one of my favorite things, not popular in my household, but reduce screen time and increase physical activity. And in Knox County, Tennessee, they worked with the city of Knoxville to create a bike and share program for the kids in that community. They printed new maps that promote dozens of miles of wonderful bike trails and routes, and they created a walking school bus. And I've heard more and more of this kind of walking school bus happening all over the country so that kids can get exercise on the way to school, kind of like we did when we were growing up. Remember the miles of walking you did with the sweet potato in your pocket? My mother repeated it just yesterday. And that's what Let's Move is all about. That's what we're really trying to do here. It's about people all across this country coming together to take action to support the health of our kids. We've seen it happen in cities, towns, and rural areas across the United States, and we're proud to announce that in just the past year, more than 330 elected officials have committed to making their city or town a Let's Move community and fulfilling the 5 community-wide goals that Dr. Coe outlined earlier. That means that more than 56 million Americans are now living in a community dedicated to improving nutrition and physical activity for our young people, and that's a good thing. So together, yes. So like we have to do everything together, we are making real progress on this issue. Not many people would have guessed that we'd be this far when we launched this initiative several years ago. But the fact is, though, that we still have a long way to go. You know, we still have work to do, and that brings me to my second job here today, and that is to ask you to keep doing what you're doing. I mean, it's as simple as that. You all are at the forefront of this work, and we need you to continue to lead the way as we work to end our country's epidemic of childhood obesity. We are in the right direction, but we need more activity. We need more leadership. We're certainly encouraged that obesity rates are starting to decline in places like New York and in Mississippi. I was proud to visit some of the schools there who have made tremendous progress throughout the state of Mississippi because of this kind of leadership. But we also know that this is a challenge that simply can't be fixed in a year or 2 or even 10. And I get this question all the time: what's the cutoff when you think this will be over? And you know, it took us a lifetime of generations to get here, and it's going to take us just as much time to turn this around. So I want to ask you all to double down on this initiative. just to push a little bit harder on what you're doing. We need you to take the ideas and programs that you learn about here today and think about ways to adapt them for your own community if you're not already doing it. We need you to bring more people to the table on this issue, more faith leaders, more doctors and business owners, more principals and teachers, and of course, more and more parents, because in the end, at the end of the day, the parents are the ones who make the decisions about how to guide their nutrition and physical activity of their kids in the home. And we need you to reach out to leaders in neighboring communities. You all are here today because you are leaders. You're setting the bar very high. And we are counting on you to be that model for others, for other communities trying to figure this out. So partner with some of your colleagues on new programs whenever it seems like it's going to work. Ask them to join you and become a Let's Move community. And as you're doing all this, trying to save your cities and balance budgets and take care of your own selves at the same time, because you all are leaders in your own right. I'm always impressed when I see a community leader who has made some significant steps in their own personal lives and have become that role model in their cities. But as you're doing all that, it's important for you to know that all of us